Every day I meet with people who are heavy. I mean, you know, day and night, well, mostly during the day. You know, day in and day out, I meet with people who are heavy. And the meetings, interestingly, are pretty similar. Over and over again, the meeting goes like this. Initially, the heavy person who's talking to me will say, listen, I'm not a bad person. I've tried, honestly, I'm not lazy, I'm not a bad person, but I have just failed at this problem. I'm struggling, I've done everything I can, and as they begin to talk like that, often tears will happen. I have fought this thing, I can't live my life, I can't do this, I can't play with the kids, I can't go to Disney World with the kids, I can't do this, I can't do that. And over again, as they recognize these things, they'll begin, as I say, almost crying. In many cases, they will be crying. And then they say, you know, I would do anything. I would do anything to get rid of this problem. You know, swim the deepest ocean, climb, I would do anything. And so I interrupt them then at this point. They're kind of getting emotional and excitable, and I say, I've got the solution. 30-minute surgery, out of the hospital the next day, just don't drink any coffee. And they go, oh, I couldn't do that. Beg your pardon? I mean, a minute ago you're talking about this life tragedy, and oh my God, Dr. Rutledge, you can't imagine how awful it is. No coffee? Oh, I can't do that. So my feeling is that the surgery itself has tremendous advantages, but you have to realize there are risks as well. And the two big risks are low vitamin and mineral problems, like iron, B12, and things like that, which are fixable by taking some vitamins and once a year checking your blood. And the other big problem that we see in our patients is getting an ulcer or gastritis. Okay, well, coffee, alcohol, cigarettes, junk foods like that are not good for that. A healthy diet is protective. So if you want the benefits of the surgery, we tell our patients, you need to pay attention and do what we say, otherwise you're going to have problems with the surgery. If you buy a house, I assume you understand you've got to pay the mortgage. Okay? If you get a car, I assume you understand that you have to do the maintenance. In the same way, with the mini-gastric bypass, we expect there's a chance of curing diabetes and high blood pressure and sleep apnea, of decreasing knee pain and back pain and ankle pain from osteoarthritis. We think the research suggests you may get 10 to 20 years of additional life, of high quality life. But there's a risk of getting an ulcer. And so if you can't follow those instructions, we don't think you should have the surgery.